This is the next pandemic, ladies and gentlemen. The White House is coming up with a strategy to roll out the monkeypox vaccinations like they did. Y'all know what else. So get ready to get forced to get the monkeypox vaccination, ladies and gentlemen. They fucking filling your bodies up with all types of poisons. Let's get into it.
Getting ready to roll out a new round of vaccines. This time, though, the shots are aimed at combating monkeypox. Public health leaders will administer smallpox vaccines to prevent more cases of that rare virus popping up. Queen City News reporter Savannah Rudisell is here with how officials are handling this virus. Savannah?
Amy, the U.S. is now up to more than 305 cases of monkeypox, and health leaders consider that still under control just as long as they can continue to track the spread. And Mecklenburg County now has one of 2 monkeypox cases in North Carolina. County Health Director Dr. Raynard Washington says he's confident one patient will not trigger a surge of cases. He says the teams are getting ready to give out smallpox vaccines to immunocompromised and elderly people. And CDC officials say the U.S. has learned a lot of lessons about containing infectious diseases during the height of the COVID pandemic.
As threats like monkeypox emerge, we run the risk of again being constrained by incomplete data from our fragmented public health data reporting system.
Monkeypox infections typically last about 2 to 4 weeks, and patients may have flu-like symptoms at first, followed by swollen lymph nodes and a bumpy rash. The disease is transmitted through skin-to-skin contact or coming in contact with bodily fluid of an infected person. Doctors say the effects can be serious and even deadly in rare cases, but they've not attributed any deaths in the U.S. to the outbreak so far. The World Health officials declared smallpox basically eradicated back in 1980. However, that is enough similar to monkeypox that they think that same vaccination can protect against both outbreaks.
Yeah, and when we heard from Dr. Raynard Washington, he kind of went into that earlier this week. So again, it's an unusual disease, and it's popped up in Europe in the past. So why is it getting so much attention now?
Well, the difference between this outbreak and ones we've seen before is that people who have not traveled internationally are getting it, and this is less sporadic than it was initially. They're also tracing it back to 2 different raves that happened in Europe. They're saying that there was a lot of intimate contact, a lot of skin-to-skin contact following those events, and so that's part of the reason why they're saying, look, we can track this thing and we can see where it's going.
Yeah, and that's like a huge thing when we think about viruses. So how can caregivers and people just avoid getting that disease?
One of the benefits, of the small benefits from COVID is that we have learned a lot more about infectious disease spreading, about ways that we can mitigate different spreads of contact. So we know a lot of our healthcare workers know this well, but they're giving this warning to caregivers. So if you have a loved one who doesn't need to go to the hospital, because a lot of these monkeypox cases don't require hospitalization, they say if you're caring for someone in your home, make sure that you've got separate household items for people, such as linens, towels, paper, or use paper plates, paper or plastic cups as well, to make sure that you're staying apart. And if you are a close contact, kind of the same thing with COVID as well. Monitor your own symptoms for about 21 days and make sure that you're not coming into contact with people who might be immunocompromised. And they say even some pets might want to give a wide berth to.
Oh, that's interesting.